Good evening. This is Dr. John Bennett again from Miami. We're broadcasting a series of Parkinsonism educational hangouts featuring Dr. Abdul Rana, a neurologist from Toronto, Canada, and also a pretty well-renowned educator, Parkinsonism educator. And tonight, Dr. Rana is going to talk about autonomic dysfunction and skin problems in Parkinson's. Good evening, Dr. Rana.
Good evening, Dr. Bennett.
Okay, let's start things right off. How is skin involved in Parkinson's?
The involvement of skin in Parkinson's disease is not very common, although it does occur time to time. We see patients who have issues with skin. It could be of 2 degrees. It could be very mild, and patients may just ignore it. And in some patients, it could be more severe and could lead to some problems. Some patients may note that they have dry body skin, but somehow their facial skin is more oily than normal. So the skin of their body could sometimes become scaly, and it could lead to dandruff. And sometimes they could develop seborrheic dermatitis. And this is more common in the eyebrows or ears and scalp. And it could be quite obvious in some patients. It could lead to xerosis, and sometimes, if intense, it could break down. And the breakdown of skin could lead to infections and may need special treatment.
What are the consequences of these skin problems?
As we can imagine that the skin is apparent, and unfortunately in Parkinson's disease, the skin problems do involve the head and neck area, as eyebrows or scalp, ear. So it's quite obvious, and people can see it. And it's dry and grayish, whitish, scaly. So it's very prominent. And even if you clean it or keep it moist, it's still apparent. So it could lead to problems with the facial appearance. And if it breaks down, causes infections. So patients may feel socially embarrassed, and some patients may accept other symptoms such as bradycardia or the stiffness because other people can't tell or see if they are sitting. And they can gauge their activity accordingly. But skin problems are such that you don't have much control. The facial skin you can't hide. So it leads to that people start avoiding social interaction, and also in the spousal relations, it could cause some problems as the skin of the face is involved. So sometimes it can cause withdrawal from social activities, and people may stop going out, and they stop meeting other people or attending parties. And they could also perceive a negative self-image of themselves because of the skin breakdown and the skin problems.
Can something be done about these problems?
These skin problems in Parkinson's disease are very difficult to treat. It's usually, in most patients, it persists. It can improve to some degree, but usually does not go away completely. So some of the self-care tips, such as avoiding any scratching over the affected areas, or sometime on the hands, you can probably wear gloves, or wearing a smooth textured cotton clothing may avoid the irritation. And the soaps and the detergents should be avoided because they can cause further itching or irritation of the skin. And if someone is using soap, they should try to rinse them completely off the body. And there are certain lotions which are available. They're over the counter. They can use after speaking with the pharmacist. for the itching, and sometimes antifungal creams could be helpful. There are some shampoos which are useful for this, and if the skin problem is in an area which can be covered, such as in the scalp, I think that could help. Otherwise, it does not respond to dopaminergic medications or any other methods which we use to treat Parkinson's disease, in my personal experience.
Okay, very good. Anything else to add before we close on this topic of skin problems and autonomic dysfunction and Parkinsonism?
The skin problem is, although a less common problem, it does not cause any motor disability, but it's socially more unacceptable to the patients themselves because of the facial appearance. So I think as physicians, we should try our best to treat to the extent whatever offer we can help to the patients. Sometimes dermatology consultation may be helpful if it becomes a problem, or skin seems to be infected or starts breaking down. I think these patients should be referred to a dermatologist at that point, at least.
Okay, very good. Okay, that wraps it up for autonomic dysfunction and skin problems in Parkinson's. Thank you, Dr. Rana.
Thank you, Dr. Bennett.